I will be showing you the procedure and how to take the blood pressure of a patient. Upon entering the room, the first thing you'll do is to greet the patient, and then you'll make sure that you're assessing the right patient by simply asking for the patient's full name. You introduce yourself and explain to the patient the procedure you will be doing. Good morning, are you Mrs. Lorena?
Yes, Doc.
Can I have your full name, please?
Molly Queen Lorena po.
Okay, great. I'm Dr. Barolo. So for today, I will be assessing your blood pressure measurement. If you're uncomfortable while I'm assessing, you can always tell me. This whole procedure will take for about 3 to 5 minutes, and I will be manually assessing your blood pressure. Okay, before we start, I would like to ask a few questions that might alter the result of your blood pressure. So did you take any caffeinated beverages prior to coming here?
No, Doc.
Or did you smoke 30 minutes prior to coming here?
No, Doc.
Okay, that will be all. After informing the patient about the procedure, let the patient sign the informed consent. After the patient signed the informed consent, you can now start the procedure. Okay, ma'am, I will be taking your blood pressure from your right arm. Make sure that the arm selected should be free of clothing, fistulas for dialysis, scars from brachial artery cutdowns, and lymphedema from axillary node dissection or radiation therapy. Position the selected arm so that the brachial artery at the antecubital crease is at heart level. Put the cuff around the arm and make sure that it is not too tight. Estimate systolic pressure by palpating the radial artery with the fingers on one hand. Rapidly inflate the cuff until radial pulse disappears. Read the pressure on manometer and add 30 mmHg. That would be your estimated systolic pressure. Deflate the cuff promptly and wait for 15 to 30 seconds. Now place the bell of the stethoscope over the brachial artery, taking care to make an air seal with full rim. And because carrot cough sounds are relatively low in pitch, they are better heard with a bell. Deflate the cuff about 2 to 3 mmHg per second. Note the level you hear the sound of at least 2 consecutive beats. That is your systolic pressure. Continue to deflate the cuff slowly until sound become muffled and disappear. That is your diastolic pressure. Remove the cuff from the patient's arm. After getting the result, inform the patient. Your blood pressure, ma'am, is 110/80 mmHg. Thank you.
Thank you, Doc.
You're welcome. Before leaving the examination room, make sure to reassure the patient. The blood pressure of the patient taken a while ago was 120/80 mmHg. The normal blood pressure is less than 120 for systolic and less than 80 for diastolic. Pre-hypertension has a reading of 120 to 129 for systolic and 80 to 89 for diastolic. Stage 1 hypertension can be classified according to age. For ages more than or equal to 18 to less than 60 years with diabetes and renal disease, a reading of 140 to 159 for systolic and 90 to 99 for diastolic. For ages more than or equal to 60 years, a reading of 150 to 159 for systolic and 90 to 99 for diastolic. For stage 2 hypertension, a reading of more than or equal to 160 for systolic and more than or equal to 100 for diastolic. Thank you so much for watching!